Hello. Welcome back to yet another class of endocrine physiology. In this class, we shall be discussing about growth hormone physiology. All right, growth hormone physiology. If I am audible, visible, let me check the settings and get back to you. So, yet another discussion on growth hormone. In various phases of our life, growth is controlled by different types of growth hormones. So we need to understand here that, for example, in case of intrauterine life, the important growth hormones which take over the responsibility of growth is insulin-like growth factor 2 in the first part of gestation, in early gestation, in early period of pregnancy, and IGF-1 in the late aspects. Apart from this, we have got insulin. These three hormones are important in maintaining the growth in intrauterine life. How do we know this? What happens is, in case of if a mother is having poor nutrition, this leads to low birth weight. And if mother is smoking, mother smokes, a pregnant lady has a habit of smoking, so this affects the vascularity of the placenta, and this causes vasoconstriction at the level of placenta, leads to various complications. Apart from this, decreased birth weight. And if a mother is suffering from diabetes mellitus in mother, we call it infant of a diabetic patient. We see macrosomia. Macrosomia is large baby. Macrosomia is defined as birth weight more than or equal to 4.5 kgs. So macrosomia occurs especially in diabetic mothers. The reason for this is they have got increased insulin levels and IGF-1 levels. Because of this, suddenly growth occurs. So we came to know that in case of intrauterine life, these three important hormones, the IGF-2, IGF-1 and insulin, play a major role in bringing about the growth. Next comes the postnatal life. In case of postnatal life, although the fetal hypothyroidism is an important factor at birth, fetal hypothyroidism per se does not cause any weight change. Hypothyroidism usually causes mental retardation and irreversible abnormalities of the nervous system, central nervous system. So thyroid hormone is responsible for neuronal growth, CNS growth, especially in postnatal life, responsible for CNS maturation. But when you talk about the growth hormone, insulin, and also thyroid, they play a major role in growth of the early childhood, and replacement of, so suppose a person has got growth hormone deficiencies, definitely this child is going to develop short stature and dwarfism. All right, when you replace these deficiencies, there is a period of catch-up growth. Sudden catch-up occurs, and this leads to normal growth. So this is how we came to know that growth hormone is important in early childhood. So we spoke about intrauterine life. Now we are talking about early childhood, postnatal life. if you talk about the sex steroids, gonadal hormones, sex steroids, they do not have major role in early childhood, but they definitely have a role in case of puberty. In case of puberty, they definitely have growth changes. All right. Then hormones like thyroid. I already told you that thyroid hormone is not having a effect on directly, does not have an effect on growth. Rather, it causes CNS, central nervous system maturation and all. So all these facts are important to understand the postnatal, early postnatal life. Next, we talk about the pre-puberty. In case of pre-puberty means just before the period, period of life that is just before the puberty changes. So pre-puberty, if you talk about pre-puberty changes of growth hormone or pre-puberty changes of growth, I'm talking about what are the important hormones that affect growth. Please remember that sometimes deficiency of growth, the gonadotropin releasing hormone GnRH, or sometimes pituitary tumor, hypothalamus pituitary tumor, they cause severe growth retardation in pre-puberty persons. All right. Then the growth hormone deficiency following puberty, it decreases the lean body mass, and it has to be replaced. The growth hormone deficiency causes lean body mass post puberty or pre-puberty. If the deficiency occurs, it causes lean body mass. It results in lean body mass. All right. And it has to be replaced. And growth hormone deficiency is a simple replacement of growth hormone is enough. There is a condition called as a lack of growth hormone receptors. Growth hormone is normal, but receptors are absent. This is called as Laron's dwarfism. Laron's dwarfism. This Laron's dwarfism is an important factor that is responsible for it develops because of a growth hormone receptor defect, and treatment here is synthetic IGF. Synthetic IGF, insulin-like growth factor. Synthetic IGF. The recombinant IGF, the name given here is mecasermin. It's a recombinant insulin-like growth factor. Mecasermin is recombinant insulin growth factor that is given in Laron's dwarfism. Please remember this point. It's a growth hormone receptor defect. Now, what are the important actions of growth hormone? Let us try to understand. Physiological actions of growth hormone. Physiological actions of growth hormone. The first important physiological action, we tend to generalize few things before discussing 1, 2, 3, 4 actions. I would like to generalize that it's a anabolic hormone. Anabolic means what? It's a constructive hormone. So last time insulin, then thyroid, and now growth hormone is anabolic hormone, and it is also a stress hormone. It's an important point. It's also a stress hormone. So what are the other stress hormones? We already discussed this. Glucagon, epinephrine, cortisol, and growth hormone. These are the stress hormones, counter-regulatory hormones. It is not only anabolic but also stress hormones. So all the anabolic hormones that we discussed, like growth hormone, insulin, thyroid hormone, androgens, these are required definitely for normal growth. At one point of time or other, you definitely require these hormones for normal growth. So the stress actually stimulates these hormones, especially the growth hormone. And what is the mechanism? We'll try to understand. The very, very important anabolic action of growth hormone is to influence protein synthesis. How is protein synthesized? Protein synthesis by amino acids. Metabolism. So it mobilizes the amino acids. Double A stands for amino acids. So important effect of growth hormone is to mobilize the amino acids to so as to bring about protein synthesis. It has got a direct effect, and this is the most important effect that stands out for growth hormone alone, because no other hormone is directly affecting protein synthesis as much as. If you really want to build up your muscles, you will have to improve your growth hormone levels. If you really want to improve the protein mass of your body, you will have to increase your growth hormone levels. All right. Whereas if you take the other hormones like cortisol, insulin, glucagon, they are increasing the lipid levels, lipolysis, they are increasing the fatty acid levels and all. I'm talking about glucagon, and I'm talking about cortisol, which increases lipid levels. But here in cortisol also weight gain is seen, but that is fat gain. Growth hormone weight gain is a protein gain, mass gain. All right. So we also provide, see, you have to provide raw materials to the person. Say suppose a very thin built person comes to you and says that, doctor, I need to improve the growth. So you have to provide both the growth hormone or you'll have to perform certain physiological activity to increase the growth hormone, endogenous growth hormone. And you should also provide raw material to the person by giving protein diet. Only increasing growth hormone does not suffice. You have to provide the raw material, you have to provide the machinery, so it starts synthesizing the protein. So whatever it is, from the hypothalamus to the pituitary. So from the hypothalamus, the signals like the growth hormone releasing hormone and the somatostatin, these two important stimuli from the hypothalamus, they act on the somatotrophic cells, which is the most common type of cell in pituitary. I already discussed when I was discussing pituitary gland. 50% of the pituitary is made up of somatotrophs, which secrete growth hormone. Growth hormone is the most common type of cell. Somatotroph is the most common type, abundant cell. Highest number cell, majority cells in the pituitary gland are somatotrophs. These somatotrophs release growth hormone, and growth hormone is a peptide hormone, water soluble hormone. So differences between water soluble hormone and lipid soluble hormone we already understood. So what are the important physiological effects of the growth hormone? One important anabolic effect I already told you. It is protein synthesis. I already told you. Anabolic effect, it is the protein synthesis. How does protein synthesis occur? By amino acid uptake into the cell. It causes amino acid uptake into the cell. It also affects the growth. Indirectly it affects the growth. Indirectly it affects the growth by acting on through IGF, insulin like growth factor. Indirectly affects the growth by acting all right. Indirectly affects the growth by acting along with the actions of IGF. And the most important effects now we'll discuss, these are the catabolic effects of the growth hormone. There are few catabolic effects also. It's a major anabolic. I said major anabolic means few actions are catabolic also. Like for example, it tends to raise the blood glucose level. How? It increases the blood glucose levels. It increases the blood glucose levels by decreasing the uptake of glucose in fat and muscles. So it increases the blood glucose levels by decreasing the uptake of glucose from the fat cells and the muscle cells. This is an important point. Next important point is it increases the free fatty acid levels. It causes breakdown of free fatty acid levels in the blood by mobilizing the fat, and it affects the hormone sensitive lipase activity. It acts on the hormone sensitive lipase in the enzyme, thus increase the free fatty acid levels. So these are the two important effects, catabolic effects. Please remember that if there is a growth hormone deficiency in our body fat increases. A growth hormone deficiency actually increases the body fat because fat is not metabolized properly, fat is not mobilized. Person starts gaining fat because of growth hormone deficiency, especially in adults, right? because in children it causes dwarfism, in adults it causes all these issues. Now, what are the important indirect actions of growth hormone? We'll try to understand. The indirect actions of growth hormone, I already discussed that it acts onto the liver, onto the various other organs indirectly with the help of, indirect effect is with the help of IGF-1. IGF-1, insulin-like growth factors. Indirect effect of growth hormone is growth hormone promotes the production of insulin-like growth factors. These insulin-like growth factors from the liver, from the skeletal tissues, these are these growth factors which act on the various parts of the body, and they bring about major anabolic effects. The most important anabolic effect is the circulating growth factor. The structure is similar to insulin. Structure is similar to proinsulin. Its structure is similar to proinsulin, and it has got a major anabolic effect by increasing the synthesis of cartilage, chondrogenesis. First important point is it causes chondrogenesis, that is synthesis of cartilage. Very, very important point. It increases the synthesis of bone cartilage, especially along the epiphyseal plate of the long bone. So if somebody wants to increase the body height, so if this is the long bone, say suppose this is the long bone, we have got the ends, we have got epiphysis, then we have got metaphysis, then we have got the diaphysis. All right, so in the epiphysis there is a epiphyseal growth plate. So from here the insulin-like growth factor is acting and increasing the length of the long bones. So if somebody wants to increase the length, some patient comes and asks you, doctor, my child is very short, I want to increase his height, I want to increase his height. So you will have to give insulin-like growth factor 1, or you will have to do some physical activity or physiological activity in the body so that insulin-like growth factor are increased, and it causes increase in the long bone length, resulting in sudden increase in the height. So chondrogenesis is an important factor on which the IGF is acting. Apart from this, the IGF also tends to increase the lean body mass. Lean body mass is increased due to its positive effect on the protein synthesis. IGF sometimes they can cause protein energy malnutrition also by interfering with the by causing catabolic, especially IGF levels are decreased in catabolic states, resulting in protein energy malnutrition. We all know that IGF-2 is responsible for growth of, I already told you, early gestation. I already told you this one. So I told you in my class previously that how is the release of growth hormone occurring. Previously I told you that growth hormone and gonadotropin releasing hormone, these are the two hormones which are released in a pulsatile manner. This pulsatile effect of growth hormone is related to your diet, it is related to your appetite, it is related to your hunger and sleep cycle. Hunger and sleep and hunger are very much important. The non-REM sleep is very, very much important to improve the pulsatile release of. That's why they say that children should be allowed to sleep properly, especially during the night, not especially during the nighttime sleep, and that too early part of night sleep helps in release of growth hormone. The growth hormone is released in a pulsatile manner, and the secretory pulses are much more likely to occur during non-REM sleep. Hence you should make your children, whoever you want them to grow in their height, weight, and proper growth of body, skin, hair, eyes, organs, everything. The children should be allowed to sleep. Sleep is very, very important. Second thing is secretion of growth hormone. It requires normal plasma levels of thyroid hormone. So thyroid hormone is important. If thyroid hormone is normal, it should be normal for growth hormone to act. If suppose it is abnormal, then growth hormone may be present, but it will not act properly. Growth hormone may be present, but it will not be able to act properly, especially in hypothyroid individuals. During the late age of our life, say 6th decade, 5th decade of your life, 7th decade of life, what happens is growth hormone decreases. This decrease in growth hormone factor we do not know. Aging causes, as you grow, growth hormone levels in your body come down, and what is acting as a stimulus of growth hormone and what is acting as an inhibition of growth hormone, let us see. So what are the factors that inhibit growth hormone secretion? Factors that are inhibitors of growth hormone secretion, let us try to understand. Growth hormone. So who inhibits growth hormone? Please remember the IGF-1, presence of IGF-1 and elevated glucose. These are the two important factors. Very, very high levels of glucose in the blood. Overeating actually causes elevated levels of glucose in the blood, and this causes a positive feedback on a hormone called as somatostatin. This somatostatin is responsible for negative feedback on pituitary gland. Somatotrope. So my pituitary is very much deformed. I'll draw a good pituitary here. Something like this, right? So there is a negative feedback on the somatotropes that results in decreased growth hormone production, especially if IGF level or elevated glucose levels are found. What are the important promoters of growth hormone secretion? Let us see what are the important promoters of growth hormone secretion or stimulators of growth hormone secretion. Hypoglycemia, less amount of glucose, then exercise, presence of amino acids in the diet, then ghrelin. Ghrelin is an important hormone that is released when your stomach is empty. This is released by the hypothalamus. Example, arginine, leucine. These amino acids, if they are present in the diet. And most importantly, the most important promoter is deep sleep. The most important promoter I'll write here, it's deep sleep. Deep sleep. These are all the important promoters. What do they do? They cause inhibition. They cause inhibition of the inhibitors, and they cause promotion of the somatotropes to release growth hormone via the growth hormone releasing hormone from the hypothalamus. Growth hormone releasing hormone from the hypothalamus. So these are the very, very important factors that are responsible for promotion of growth. These are the important factors which are responsible for the inhibitor and promoter factors for the growth hormone. Let us try to understand what are the important puberty changes that occur in males and females. The important puberty changes, let us talk about the puberty changes and the growth hormone and its role in the reproductive changes. So hypothalamus generates pulsatile activity. It increases pulsatile activity just before puberty, prepubertal changes. So the first factor that is observed in a female is development of breast. We call it thelarchy. Thelarch. So because of circulating levels of estrogen and then increased levels of progesterone, what happens is development of breasts occur, thelarchy. And in males, the first sign that is noted is enlargement of testis. Testicular enlargement of testis, and this enlargement of testis is mediated by the FSH. The thylarchy, that is breast development is promoted by estrogen followed by progesterone. Sudden increase in rise in estrogen followed by progesterone. And then what happens after these two? These are the first changes. After this, what happens? Pubic hair and axillary hair are developed. Pubic hair and axillary hair. The hormone that is responsible for pubic hair in male and female are androgens. Because of circulating levels of androgens increase, and these androgens are responsible from the adrenal gland. These androgens are responsible for growth of the hair. Next, what happens is physical changes start. Physical changes like during puberty, the androgens promote secretion of anabolic hormones. Anabolic activity increases, thyroid hormone drive increases, growth hormone increases, IGF-1 increases. All these will stimulate and increase the cartilage size, epiphyseal plate of long bone increase. Especially in males, what will happen is androgen causes testicular development, and in females, the androgens are promoting mineralization or fusion of epiphysis. That is more important. So estrogen also causes fusion of epiphysis. Estrogen also causes fusion of, that's why during puberty, if suddenly more amount of estrogen is released, sometimes the females are tend to become shorter. The reason is in the female, the growth spurt begins early in puberty and is near completion at menarche. Just before menarche, the growth is maximum achieved. Whereas in males, the growth spurt occurs at the end of puberty. So growth spurt in females, it occurs in early puberty, whereas in males, it occurs in late puberty, end of puberty. Early puberty and end of puberty. All right, these 2 points please remember. That completes the understanding of growth hormone. Growth hormone excess post puberty, we call it acromegaly. We'll discuss acromegaly treatment and clinical features in clinical medicine. That will be best for you to understand. For now, let us conclude the topic, and if any doubt, please ask me through the email or chat. All right, thank you so much.